I work at Harborview Medical Center, a regional trauma center, and we see gun violence there a fair amount. I'm a pediatrician, and I see it in youth, particularly the males 14 to 18 years of age. So it is really a common problem. But I think it's important for us to realize that in the state of Washington, 75% of the gun deaths are suicides. We think a lot about homicides, but 75% of suicides. But I think also the requirement for people to keep their guns locked up, the requirement that stores talk about that, safe storage, is critically important. As a pediatrician, I don't want to see more 8 and 10-year-old boys coming in having been shot because they and their friend found dad's handgun and played with it and somebody got shot. There was a study conducted at Harborview about 10 years ago that showed if you have safe storage of guns, that they will reduce youth suicide and youth accidental injuries by 75 to 80%. So it's actually very effective and is very important. We know that safe storage does work. And Harborview has joined with Seattle Children's Hospital and the King County Health Department to promote safe storage of guns and has events where we give out safe storage devices for free. I think the fact that this gun initiative passed by 60 to 40% shows that the people in the state of Washington really are behind measures to try to restrict access to guns for people who shouldn't have access. The people overall do want to have further restrictions on access to guns. We're not talking about gun control here, really just talking about making sure that guns don't get to the hands of those who misuse them to harm themselves or others. There's lots of other things that I think we can all try to do. I think one of the messages out there now is how do we get people to actually safely store their guns? We know that it's a law. We know that a lot of people support that, but many people don't do it. We have to work on figuring out how we can really get that message to people and have them actually do that day in and day out.